¿Vamos? Ok. Ya. Ok. ¿Listo? ¿Empiezo? Okay. Vamos a comenzar.
Very well, we are going to get started. Thank you for joining us on this occasion. At this time, we will be talking about health and resilience. Obviously, the topic is to listen to the representatives of civil society who have worked on these documents and then open up our conversation. Let me give the floor to Sandra Cerrato from the Institute for the Sustainable Development of La Lenca Women of Honduras. Sandra, please, the floor is yours. Good afternoon. I don't know if you can hear me. I'm Sandra Cerrato Flores. I am here with Jacqueline Ruiz, Kendall Trapp, and we are the spokespeople for the Working Group on Health and Resilience in the Americas. Today, I'd like to present a summary of the recommendations of the Civil Society of the Americas in the context of the political commitment of the nations of the Americas here at this summit to implement a plan of action beginning this year, 2022 through 2030. During the pandemic, we saw set aside infectious diseases and many other treatments, including human hormone treatment, gender adaptation, mental health, and other procedures. And at this very key event, we'd like to present the following recommendations. First, achieved by the 10th Summit of the Americans, an agreement on a plan of action on health and resilience in the Americas in an effort to ensure greater access to all in terms of the ability to engage in resilience, with including psychological and physical health. This includes women, children, adolescents, older adults, people with disabilities, the LGBTI community, indigenous and Afro-descendant communities, faith-based communities, migrants, and other groups in vulnerable conditions. 2. The Health and Resilience Action Plan includes the implementation of leadership programs in sexual and reproductive health and family planning, international standards in human rights in health that includes protocols for caring for vulnerable groups, including pregnant individuals and the fetus, ensuring there is attention to contraceptive requirements, infectious disease care among member states, including the highest morbidity and mortality rate diseases and illnesses such as tuberculosis and HIV, hormonal treatments that include transgender persons, as well as patients requiring treatment for terminal illnesses. We specifically request greater access for those who need antiviral treatment and the medications and supplies necessary to ensure such treatment. In particularly, we believe that it is appropriate to immediately review any practices that modify the sexual characteristics of intersex persons without reliable medical reasons and without the full and informed consent of the intersex individuals, based on the American Convention of Human Rights and other instruments of protections, especially emphasizing the protection of children's rights and family life. Include strategies that ensure universal health by eradicating the gap in terms of unemployed people. 6, establish national plans and public budgets in health, creating auditing, monitoring, and follow-up mechanisms that contribute to ensuring proper compliance with plans of action. 7, strengthen the growth of education and training of professionals in the field of medicine, comprehensive public health, biomedical, scientific education, telemedicine, and improvements in treatment to ensure the development of these technologies with professional ethics, as well as confidentiality, ensuring the inclusion of Afro-descendant and other groups in recognition of their ancestral knowledge, preparing the hemisphere under international standards to ensure that we see the documentation of COVID and other similar diseases. Also, to pay closer attention and provide care for non-transmissible diseases, ensuring sustainability and the financing of public health systems in this regard, insofar as these illnesses are responsible for the greatest number of costs in the public health system. 9, avoid the pollution of the environment and water, strengthening the availability of drinking water and allowing for greater access to individuals to all types of cross-cutting single health opportunities with a view toward improving results in health throughout the region. 10, to create conditions to strengthen the capacity of manufacturing and marketing safe, effective and high-quality medical products in the region, to adopt policies that support sustained multi-sectoral participation in the areas of health, science and technology, as well as industry and trade, considering the provisions of the Nagoya Protocol as well as ILO Convention 169. 11, to create the conditions to obtain raw materials for medication and thus be able to strengthen, manufacture, create, transport, and sell these products for our healthcare systems in an effort to ensure transparency in the manufacturing and sale of these medical products, ensuring that the rights of Afro-descendants and indigenous peoples are respected in these manufacturing processes. Next, incorporating the voice of patients and all the aforementioned vulnerable groups in government consultations in a comprehensive manner involving health measures, including the approval, financing, and strengthening of best practices, including ancestral health knowledge, considering the provisions of the Inter-American Principles on Human Rights of all migrants, refugees, and stateless persons, as well as urging member states to strengthen mental health services and the prevention of problematic use of psychotropical substances, suicidal behaviors, particularly for vulnerable groups. Thank you very much. Thank you. Thank you, Sandra. Let us now, as we have on the previous panels, hear the remarks of our government. We have Fernando de Cruz, who is the national coordinator from Peru, and Ambassador Washington Abdallah, representative of Uruguay to the OAS. We'll leave the floor with the delegate from Peru. Thank you. Thank you very much, and good afternoon, everyone. I bring special greetings to the members of the panel, and particularly the members of civil society, who I would like to congratulate for all of these proposals that they've made here today, and I'd also like to take advantage of the opportunity